What are the contraindications of power breathing? Namaste, I am Dr. G. Timarayagoda. I am an allopathic medical practitioner for the past 40 years and a skin specialist interested in chronic skin diseases. Power breathing or any intense breathing techniques can have potential contraindications or risks, especially for individuals with certain medical conditions. It is important to consult a healthcare professional before engaging in any breathing practices, especially if you have any of the following conditions. 1. Cardiovascular conditions. Individuals with heart conditions such as hypertension or high blood pressure, heart arrhythmias, coronary artery disease, or recent heart surgery should be cautious with intense breathing techniques. Rapid and forceful breathing can strain cardiovascular system and potentially lead to complications. 2. Respiratory conditions. People with conditions like asthma, chronic obstructive pulmonary disease, that is COPD, or other respiratory issues may find certain intense breathing techniques difficult or triggering. These techniques could worsen breathing difficulties and potentially lead to respiratory distress. 3. Pregnancy. Pregnant individuals should avoid intense breathing techniques that involve breath retention or rapid breathing patterns, as these could affect oxygen supply to the fetus and alter blood flow. 4. Neurological conditions. Neurological conditions such as epilepsy or other neurological disorders could be triggered or exacerbated by rapid and forceful breathing patterns. 5. Hyperventilation. Some intense breathing techniques can lead to hyperventilation, which can cause dizziness, lightedness, tingling sensations, and even loss of consciousness in extreme cases. 6. Anxiety disorders. Certain breathing techniques involving rapid or forceful breaths can trigger anxiety or panic attacks in individuals who are prone to these conditions. 7. Recent surgeries. Individuals who have recently undergone surgery, particularly involving the chest and the abdomen, should avoid intense breathing techniques until they are fully healed. 8. Uncontrolled blood pressure. If you have uncontrolled high or low blood pressure, certain breathing techniques can further disrupt blood pressure regulation. 9. Glaucoma. Breath retention techniques can increase intraocular pressure and potentially become harmful for individuals with glaucoma. 10. Osteoporosis. Breath retention techniques that involve forceful exhalation can put strain on the spine and should be avoided by individuals with osteoporosis or other spine related issues. 11. Vertigo or balance disorders. Intense breathing techniques that involve rapid head movements or changes in body position may worsen symptoms of vertigo or other balance disorders. 12. History of stroke. Individuals with a history of stroke or other cerebrovascular issues should avoid breath retention practices that can impact blood flow to the brain. Remember that individual responses to breathing techniques can vary, and what works well for one person might not be suitable for another. It's always best to consult a qualified healthcare professional before incorporating any new breathing practices, especially if you have any underlying health conditions. If you are considering practicing intense breathing techniques as part of a specific exercise regime or practice, consult with a fitness or yoga instructor who is experienced in working with individuals with diverse health needs. All the best. Namaste.